everyone, my name's Angela and I'm a retired nurse. My doctor told me that I need B12 injections. And since I'm a nurse, I didn't want to go into the doctor's office. And it occurred to me that not everybody would know how to give themselves an injection. Quick and easy and, believe me, painless, if you do it right. So, I have my B12, my prescription, and I have a needle. Believe it or not, the longer the needle, the less it hurts. I also have an alcohol wipe. First thing I'm going to do is I'm going to wipe the top of my syringe, and I'm going to lay the wipe down. I have my syringe here, and then little nursing trick, I use my tea, you shouldn't, is to inject some air into the thing, into your glass vial. There's 2 sets of circles there. Make sure I can see what I'm doing. Inject a little air in there, and with the tip of your needle, I can see it right inside as I'm going to draw out my B12. And I want to make sure I get every little drop because this stuff is awesome. Gives you energy, besides helping to fix pernicious anemia. So now that I got it out, I'm going to pull this back a little bit, make sure I get it up in there. Excellent. Some will tell you to leave a little bit of an air bubble because it is going into the muscle. And if it's going into the muscle, then leaving a little bit of air at the end isn't that difficult. I'm going to recap my needle. It's a clean needle. Now I'm going to get ready for my injection. I'm going to move this. I've never done this before. All right. In order to give yourself an injection, the least painful spot is here in your hip. You can do it in your arm. I don't like it. Sub-Q, those hurt and they leave a knot. I'm going to do it right here in my hip. Now by doing this in my hip, I'm going to feel where my hip socket is right here. And this section of your hand should go on that socket. So right here is where I'm going to put the implant. When my finger is down, that is my sciatic nerve. You do not want to inject there. It will hurt and cause long-term, it could cause long-term problems. All right, so right here is where I'm going to inject. Again, this is to do at home, not with other patients. I have my same alcohol wipe. I'm going to expose the area. I'm going to wipe it. I'm going to put the alcohol wipe between these 2 fingers so that when I give the injection and I pull it out, I'm able to go ahead and stop it and put it right here while I put down my needle. Okay, so this is how you can do it on your own. I already know where I'm going to inject. I've got my alcohol and I've got my medication. So by exposing this one little area, all right, I happen to know it's going to be right here. I'm going to wipe, put it between my 2 fingers. I'm going to inject quickly and firmly, all right? Pull back. There's no blood, so I'm not in a vein. I'm going to give myself my injection. And with 1 cc, it should be about a 5 count. I'm done. I have my alcohol wipe here. I'm going to pull it out, place it, and rub. By rubbing it, I'm dispersing it into the muscle. All done. Painless. Now, proper care of your needle. I know myself, and anything that touches me, your germs are good. You know your own germs. But if you're helping somebody else, never recap the needle. You can set it down like so and recap it this way. So that you do not get stuck. You should have a proper way to go ahead and tend to this. If you do not, as my doctor did not give me a Sharpie container, and when I see him next month, I'll ask for one. You can remove this needle, place it in a plastic bottle, and throw it away. Although, what I'm going to do is I'm going to take it. I have a little baggie to keep it out of reach of my grandchildren. And I'm going to take all these little baggies to my doctor's office so that I don't accidentally get anybody else stuck. That is what you should do. Just go ahead and save them and give them to your doctor and ask for a little Sharpie's container. My insurance should pay for it. All right, thanks. I hope that was helpful. Bye.